Hello and welcome to Inside Exercise. I'm Emeritus Professor Glenn McConnell from Victoria University in Australia. The idea behind Inside Exercise is to bring to you the absolute who's who of exercise research. So exercise physiology, exercise metabolism, and exercise and health. And what I'm really wanting is for you to get your exercise information from the research experts rather than from influencers. And indeed, today I'm bringing to you Professor Margie Davenport from the University of Alberta in Canada. She's an expert on exercise and pregnancy. So we talked about the effects of exercise on the mother and on the offspring. So talking about exercise before pregnancy, during pregnancy, and both on the mother's health, the baby's health during the pregnancy, the baby's health after the pregnancy, the effect of exercise during pregnancy on pre-eclampsia levels, gestational diabetes levels, etc. I found it very interesting. I think you will too. So stick around. You'll see in the notes that there are timestamps. So if you're on YouTube, you can look down and you'll see in blue different times. If you click on those, it'll move to that section. And on the other platforms, you'll see the times, but you can't click on them. That means you can jump around a little bit, but to get the full context and the full understanding of the area, it's much better, of course, to watch the whole podcast. Also, if you can do me a favor and help get the message out about Inside Exercise, if you can please like, subscribe, leave comments, etc. The algorithm will tend to then suggest Inside Exercise when people do searches on a particular aspect of exercise. For those of you watching on video, you'll notice that my hairstyle is quite dramatically different today. I managed to mess up, so I use a clipper on my hair, and I didn't realize it was on the lowest possible setting, so I had to get rid of it all. Okay, so enjoy the chat. Hi, Margie, how are you? Welcome to Inside Exercise.
I'm great, thanks. Great to be here.
Great. So we're going to talk about exercise and pregnancy, which is interesting. And as we'll see here and there, I've done a little bit on that sort of in the periphery, more with sort of rodent studies. We'll be talking obviously more about humans today. But what I like to do at the start is sometimes just ask, how did you get into exercise research? Were you like an exerciser, a sports person, or were you a researcher first and then you moved that way? How did you end up doing this sort of stuff?
Mm-hmm. No, actually, so I was an athlete for a long time, and I was a former national team athlete in synchronized swimming. And so way back when I was training 6 to 8 hours a day, loving life, enjoying Montreal, doing a little bit of school on the side. And then I had a career-ending injury and had to figure out what I was going to do with the rest of my life. And so I moved into going back to university again and decided kinesiology was where it's at. It's as close as you can get to being an athlete just by studying exercise and exercise physiology. But I have a strong history of obesity and diabetes in my family. And so when I was thinking about doing research and going on to graduate school, I was pretty convinced I was going to solve diabetes and obesity with exercise. Very naive 20 years ago. But the only person that was in the faculty that was doing that type of work was an exercise physiologist specializing in pregnancy and postpartum. So I went and knocked on her door and asked to have her take me on, and she pretty much said no, but I finally convinced her to say yes. And the rest is history. I went into the lab and I fell in love with the physiology of pregnancy, postpartum, ended up doing my PhD in postpartum exercise, and I haven't looked back.
Wow, that's interesting. Well, sorry to hear about the diabetes in the family, et cetera, and obesity. But even though you're naive, I think exercising, and I assume you're talking about type 2, yeah? Type 2 diabetes?
Yeah, type 2.
Yep. And I should say, if people want to hear more about type 2 diabetes, they can look at earlier podcasts of John Hawley and other ones. But, I think it's fair to say if you exercise regularly and eat well, you can maybe not cure it, but set it back a long way. Have you had much luck? It's one thing knowing that. It's another thing trying to get your family members to do it.
So when I retired, I was the annoying child that moved back home for 6 months. And as a former athlete at that point in time, I got both my parents up and walking, and they ended up doing marathons after that. And they, even to today, 20 years later, they still exercise probably more than I do. They're unbelievable. And to date, no diabetes.
Wow. There you go. There you go. That wasn't a setup. I think you have cured diabetes. There you go. Now, the other interesting thing I thought of while you're discussing your background, which sounds very impressive, and sorry about your career-ending injury as well, was, how you ended up doing something more health-related than athletes. So a lot of us, I used to be a distance runner and started off, sort of applied, and then ended up more, mechanistic and health-related. Did you at the start, were you wanting to work with athletes and things, or were you actually quite keen because of the family background to do something health related?
So kind of a mix. I mean, exercise, pregnancy, and postpartum is kind of interesting 20 years ago because there was not a lot of information at that point in time. We certainly were not talking about elite level athletes continuing during pregnancy and returning to sport postpartum like we do today. So it's really a different world now. Yeah, so it was, I guess, a combination between personal history, really wanting to sort of dive into that side of it, and as much as I would have liked to, I just don't think the opportunities were really there.
Oh, absolutely. So that's interesting. So one thing you did say you wanted to give a bit of a brief history on. So why don't you expand on that a little bit? So what were we saying 20 years ago? Was it sort of like women shouldn't exercise really when they're pregnant, or what was the thinking back then?
Yeah, so 20 years ago, physical activity was recommended, but we really had a lot of questions and concerns about whether or not if you exercise too much, if you exercise at too high of an intensity, or did the wrong type of activity, if it was going to potentially harm either the mother or the baby. But, going back even farther in history, it's funny because, things sort of go in waves and we almost come full circle. But back in like 1400 BC, there's excerpts in that are out there that basically are suggesting that labor and delivery of really sedentary, sort of higher born people were actually a lot worse than they are for people who are the slaves that were working out in the fields. By the time we got to like the 19th century, women were being told that they should be confined, stay inside, avoid all strenuous activity because they might dislodge their uterus. But then as we sort of moved into, more in the last about 50 years, the first guideline for exercise in pregnancy was in 1985 with the American College of Obstetricians and Gynecologists. And that was the first to really start to recommend sort of broad span that it's okay to exercise during pregnancy, but there were a lot of limits that were placed on it. So the most common one we hear about is don't exercise above 140 beats per minute. That was from 1985. It was reversed a couple of years later. When I was pregnant with my second 9 years ago, I was told, you shouldn't exercise above 140 beats per minute. And I had to sort of stop them and say, well, actually, there's more research since then in the last 30 years. But I was on a call with an athlete group just a couple of days ago, last Friday. And we're still hearing that today. We've had Canadian guidelines come out back in 2019. Basically, there isn't 140 beat per minute limit right here in our country. And that information is still getting out there, which is really unfortunate, and why doing podcasts and the work that you do is so important. The knowledge translation is really not happening.
Okay, well, that's interesting. So the 140 has stuck around despite more updated guidelines. So what is the sort of, is there sort of like a cutoff nowadays, or, what is the intensity and I guess we'll get to duration sort of guidelines nowadays?
So in the 2019 Canadian guideline for physical activity throughout pregnancy, we did recommend a moderate intensity. So 140 would still fall into that moderate intensity. And the reason for that is we actually, at that point in time, didn't have a lot of information about more vigorous intensities. And so anybody who wanted to exercise in that more vigorous intensity zone needed to speak to their healthcare provider, get a little bit more guidance, make sure that baby was continuing to grow appropriately, that they were gaining the appropriate amount of weight so that baby could develop well. But since that time, there's actually been more information that's been coming out. The research has become quite active in this area specifically. And so, we're the general guidance is still kind of like that 80 to 90% of max is what you shouldn't be going over. But work from our lab has started to change that specifically. There was two studies a number of years ago, which did graded increases in activity. It was a 25-minute protocol. By the time they got to the end of 25 or 30 minutes, they'd be above 90% of max, and they monitored fetal heart rate. And what they found was that in some cases that the baby's heart rate would slow, which is potentially suggestive that there's fetal distress happening. And because of that, all guidelines around the world pretty much said don't go above either 80% or 90% of max. But when we're talking about elite athletes who are now trying to stay in sport for a longer period of time, there has to be a way that we can allow them to see if they can do that higher intensity exercise, and HIIT exercise is the perfect example. And so that's what we were actually testing to see if these briefer bouts of high intensity exercise potentially had issues for the baby, and the fetal heart rate was fine throughout.
Oh, so you didn't see a slowing of fetal heart rate at all
Nope,
during HIIT
not at all.
exercise?
Yeah. And so there's got to be some sort of balance between, we can't have these really broad spanning recommendations. As soon as you have one study that says, you can't do above 90% because you might have a slowing of a fetal heart rate, that actually caused most guidelines around the world to say you cannot do it. But we have to find the balance, because doing a graded exercise test that's 25 to 30 minutes long is not the same as 1 minute of high intensity. The physiology is different.
So did they do like a max test up to VO2 max or something all the way up?
Yeah, pretty much.
And they saw a slowing of heart rate at the highest intensities?
In a subset of these very highly trained athletes, yes.
Okay. And do we even know a slowing of it? I mean, I guess there's been all sorts of other conditions other than exercise where they show what a slowing of heart rate is indicative of fetal distress. Is that how it works? Because part of me thinks it would go the other way almost. If there was, I guess it depends on what's going on.
Yeah, so as part of the 2019 Canadian guideline, we did 12 systematic reviews and meta-analyses, which were looking at basically every health outcome that we would be really caring about when we talk about exercise and pregnancy and maternal and fetal health. One of those reviews was looking at fetal responses to exercise and pregnancy, and you're absolutely right. In general, when mom is exercising, the fetal heart rate will go up a couple of beats, like 5 or maybe in some cases 10 beats per minute. But in some cases, if we do see that bradycardia, that slowing of the heart rate for too long of a period of time, if that's happening for an extended period, that is very concerning. That would be an indication to deliver the baby. But interestingly, with these even acute bouts of exercise where they did maximal exercise, it recovered when the exercise stopped. And so we don't know the health effects of that. And so certainly there's more work that needs to be done. But because of those studies, we almost stopped all research in high intensity exercise for a period of almost 10 years. And so we're just getting back to the point where we can do those studies again to, help athletes who we know that many of them just continue to do that high intensity exercise regardless. They just don't know what the, potential harms or benefits are because we don't have the data to support it.
That's interesting. So the athletes are tending to do it anyway. Is that right? Yeah. They're tending to. Yeah. Okay. Yeah. And I'm figuring you may have had some trouble getting your ethics approvals to do the HIIT training, based on the previous study. Did you have much luck, much trouble with that, or?
No. So I've been at the University of Alberta for 11 years now, and we've done a number of exercise tests. I think one of the important things that we do here is that we monitor the outcomes that we find are really important. And in this particular case, the key outcome that is going to drive the decision about whether or not athletes and recreational or elite can and should be exercising at these high levels is the response of the fetus. We don't typically get very concerned that the mom's not going to be able to do it. We expect that if she's doing HIIT training, she's physically able to. But where we become concerned is we don't know what's happening to the baby at that point in time. So when we're doing the studies, and we typically will recruit people who are already doing HIIT
So they're doing it
exercise,
anyway. That's
heavy
the point.
lifting, they're doing
Exactly.
it anyway. They're actually safer in my hands, where we're monitoring the fetus and we know exactly what's going on. And I think that's the really key point, that when we're doing these studies, we cannot be running HIIT studies or heavy lifting studies or anything like that without actually monitoring the fetus. We need to answer the question that is going to change the guidelines, or at least help drive clinical decisions on that standpoint.
Exactly. I can imagine if you were trying to recruit, because, you know, I've done studies and Salone's having trouble getting ethics approval, and I've been on the ethics committee. I can imagine if you were getting people that didn't exercise and you're saying, okay, we don't want to do HIIT or we want to do weight training, it might be harder. But as you say, you make the point that these people are doing it anyway. So let's monitor them, etc. So with the monitoring, I'm just wondering, obviously it's easy to monitor the mother's heart rate, etc. How do you go about monitoring the baby's heart rate?
Yeah, so we use an ultrasound. So if you've ever been to an obstetrical appointment where you're looking at baby for the first time, it's the exact same technology. Depending on the study, depending on the level of risk of the person that we're working with. So for example, we've done this with, you know, just like HIIT exercise, but we've also done it with women who are carrying twin pregnancies. And so in those cases, we actually have a cardiologist who comes in and does those assessments. They look at the fetal heart before we even start the exercise, just to make sure baby's actually okay. We also look at fetal heart rate. We look at umbilical blood flow, so the blood flow that's going from the placenta to the baby. We look at brain blood flow if we're fast enough. As well. So we do as many clinical measures as we can, because those are the really important things that we need to actually know when we're doing these particular studies.
So you're just moving the ultrasound around, or do you have more than one ultrasound? Or, you know, sorry, obviously with twins it's different, but if you've got one baby and you're trying to look at the brain blood flow and the heart, etc., do you have more than one ultrasound, or what do you do there?
Well, we do have multiple ultrasounds. Typically, we only have one tech that is actually able to do it at a time. And so they are in the same, one of the unique things that we do in our lab is that they will do an upright exercise and you measure the fetal responses in that exact same position. I know that other previous work, they will actually come off of the bed or off of the bike or the treadmill, and they'll lie down on a bed, which is going to change the physiology to a certain extent.
Oh, so I was imagining you were doing cycling, because everything would be jiggling around in there if you're doing running. But do you actually do running as well with these measures?
No, we typically, with the HIIT, because it was so unique, and we took them, you know, by the end of it, the goal was to get above that 90% of maximal heart rates. On average, we were getting them above 96% for safety reasons, because this was first ever. We did do the bike in case they were, you know, having post-exercise hypotension or anything like that. We could get them pretty quickly.
Okay, so it would be harder. I'm imagining it's harder for someone to measure using ultrasound, measure things while they're running anyway, wouldn't it be?
Yeah, no, you can't do it during.
So
at least not that I've figured it out. There's I know there's a portable device, but I haven't
So I guess that gets to the question of the different modes of exercise. So anyway, I'm really impressed. I think that sounds great, the studies you're doing. I didn't realize people were doing that. Didn't realize you were doing that. So it's great that you're doing these measurements and you're finding. So when you're looking, I'll get back to my point in a minute about running versus cycling, but are you finding, so brain blood flow, heart rate, are you looking at actually heart sort of, you know, can you look at, I don't know, how the heart's functioning, etc., during the exercise as well? And umbilical blood, is everything good? Everything's fine? Yeah.
It'll be fine. That study isn't published yet, but it's coming soon.
Great.
Yeah. And now the HIIT study, we have published it, and again, we're not seeing any adverse effects. The mom and the baby are tolerating that high intensity exercise quite well. Now the caveat with that, there's two. First, these are all people who have typically done HIIT before and certainly during their pregnancy as well. And then the second thing is that we screen everybody for contraindications. So contraindications are medical reasons why somebody should not engage in more moderate to vigorous physical activity, because there has been some data or theoretical risk that it might adversely impact either the mother or the baby. And so all of these people have been pre-screened before they do the exercise. So it's not a broad recommendation that everybody should be doing HIIT.
Okay.
These are highly active people who have been not medically pre-screened, but they have been pre-screened for contraindications to make sure that they don't have any specific reason why they shouldn't be doing moderate to vigorous intensity exercise.
Yep. Okay, and then I guess the question then is, so I was touching on the modalities. So if you're doing cycling, can you assume that the results you're getting would be the same with running, or do you have to try and do those studies one day? Because naturally there's a bit more going on there with the movement of the baby and
yeah. I would expect that there would be a potential difference. I mean, we have seen data looking at just like rating of perceived exertion is different across pregnancy if you're doing a cycling exercise versus if you're doing a walking treadmill protocol. But looking at different modalities, with the exception of really looking at aerobic-based activities versus resistance training activities, we haven't gotten to that level of detail yet. When we talk about exercise in pregnancy, it is still a very understudied and novel area.
Oh, it sounds like you're doing great stuff. I guess I'm just wondering if there'd be a difference or not. And I guess you don't know until you do the research. Now, one question, I've got the guy, Mark Preben Lindback. He's fantastic follower of the podcast, and he always sends through about 6 questions or something. Now, one of them I hadn't thought of, which I think is a good one to bring up now, is does having a high maternal VO2 max at baseline and or during pregnancy also benefit the fetus, or is it the regular exercise stimulus that mediates the benefits? So it made me think of that while you were saying that the people that you're testing are already, doing the training, so they naturally have a higher VO2 max initially than maybe a recreational person. So I wonder if that might make a difference as well. That so anyway, do you actually know that if someone's fit already, I guess there's less of a stress because they can maintain their homeostasis more?
The answer is no. I'm not aware of any data that specifically looks at that, but there's a couple of things that we can kind of think about. So if we talk about athletes who are naturally going to have, well, not naturally, they've trained to have a higher VO2 over many years, regular exercisers, same thing. We know that they generally have better health outcomes than the general population. Whether that's due to the higher VO2 itself or whether it's due to the chronic activity, it's really hard to say. But I did publish a study with Nathalie Dion in Montreal a year or so ago, where we were looking at VO2 and risk of developing preeclampsia. And basically, if you did have a lower VO2 either before or during pregnancy, that you did have an increased risk for developing preeclampsia. Hardly any data around that. It's very new. It's an area that needs to be looked at. But yeah, I mean, the easy answer is we don't know.
Yeah, it's an interesting question I hadn't really thought about, and I was thinking more as you were discussing. I guess you could do so you know how you were able to get ethics approval to study these people because they were doing it already. Maybe if you had people that were doing like weight training or something, and they don't have a higher VO2 max, you could then look at them and see, So I wonder if you have looked at, because I know we had a bit of email back and forth. So you wanted to talk about sort of high intensity exercise, which we touched on, but also heavy lifting. So people, tend to, or even just with the non-pregnant population, you tend to think, oh, you don't want to put your blood pressure up too high and things. So have you looked at heavy lifting as well?
Yes, actually we have. So one of the things that happens or was put into the 2019 Canadian guidelines is that you should, we recommend that you engage in both a combination of aerobic and resistance training. And I mean, that applies to the general population. Resistance training, strength-based training really is highly beneficial, but in different ways than aerobic activities. That being said, in pregnancy, there is such limited data that is out there at this particular point in time. A lot of it is really focused on sort of body weight exercises, maybe some bands, and at best you might get into light barbell or dumbbells. But I was working with somebody who just emailed me out of the blue, and she was like, hey, I was wondering about heavy lifting. And I'm like, well, there's no data on it. And at that point in time, the recommendation to avoid heavy lifting really comes from the occupational literature. So when we talk about occupational lifting, you're typically going to be doing very poor form. You don't typically have big rest. You might do it repetitively many, many times over the course of the day. And so some of our reviews that we had done, systematic reviews that we had done, demonstrated that if you lift more than 11 kilograms at a time during pregnancy, there's an increased risk for delivering early, having a miscarriage, and having preeclampsia or developing preeclampsia. But it's very different than lifting heavy weights in a gym where you're doing proper form, you're using your breath properly, and you have adequate recovery between. And so we did a cross-sectional survey because we were not able to get ethics to do a heavy lifting study in pregnancy yet. So we had to start with a questionnaire. And so she's very connected, Dr. Christina Previtt, who is now working with me as a postdoctoral fellow. She's very connected in the functional fitness world, and she is one herself. And so we looked at individuals who had lifted at least 80% of their preconception body weight. And some of them continued during pregnancy, some of them did not. And the ones that continued during pregnancy, they actually had overall better health outcomes than those who did what the guidelines recommend, which is to stop lifting heavy during their pregnancy. So because of that particular study, we were actually able to go back to ethics, and it did take a bit of time, but we've just completed a study on heavier, not quite heavy lifting, but heavier lifting during pregnancy, where again, we look at fetal heart rates and umbilical blood flow before and after these different modalities that we were looking at. So it's starting to change.
Are you able to say what you're finding yet, or?
I probably shouldn't until peer review, but given our discussions before, I don't think anything's going to be a real surprise.
People do, though. Okay, it's actually been good. But what I talk to people on here, they usually say their latest stuff. But anyway,
do they?
We could maybe pretend it's like a conference or something. Is that all right? It's up to you. It's up to you.
Pretend it's a conference.
Yeah, it's up to you. Okay, don't worry. But you gave us a hint anyway.
The outcomes are great. We'll go with that.
Great.
No issue.
Okay.
Yeah.
All right. No, I've actually been quite surprised, quite pleasantly. People will tend to say what they're finding, but you've pretty much done that as well. But you did give us a hint. So the findings are good.
Yeah. The findings
are great. All right. And they were heavy, not really heavy, but heavier than kind of heavyish weights.
Yeah. So we were looking at basically 70 to 80% of maximal efforts, 10 RM, not 1 RM.
Okay. And this is great. So again, so just to clarify, so you're looking at, I don't know if you did that study, but generally the heart rate of the fetus, yep. So you're actually looking at the heart function as well, is it? With the ultrasound, you can actually see what ejection fraction was.
Yeah, so we didn't look at heart function for that one because you need a cardiologist to be able to do it. But fetal heart rate and umbilical blood flow are.
Umbilical blood flow. Okay. And you're just wanting to see if umbilical blood flow doesn't change, or?
Yeah, or if it does change.
Yeah, and you're finding it just, so with your studies generally they don't change. But I guess I'm getting at,
or they change for the better.
Yeah, I was wondering what that is. So if it's higher, is that better? So you're saying?
No, higher is actually worse. So higher is a greater resistance to blood flow at the level of the placenta. So higher resistance is not a good thing. It's I don't know. This is probably really getting into the weeds, but basically, if you have less resistance to blood flow, that's typically going to be a little bit better.
Okay. So just remind me here. So we're talking about from the mum, from the placenta to the baby, umbilical blood flow. And if it's higher, that's bad because what it suggests higher pressure or something, or you said less resistance.
A higher resistance to the blood flow, and then that can cause, increases in it's not really increases in blood pressure, but you can think of it in the same way.
Okay. All right. And I guess we've been thinking about blood flow, heart rate, and things like that. Do we have any idea? And I guess this is I was thinking earlier, we should probably talk about the old sheep studies and I don't know if there's been other studies, but I'm assuming a lot of this background on, don't exercise too hard, etc., is from non-human studies. And maybe you can just explain that. And then I also wanted to know, like, we've been talking just about heart rate and things like that, but what else have they looked at? I'm sure they've looked at oxygen concentrations and things like that.
Not in
the blood. No, sorry, in the sheep stuff. I'm wondering. Okay, sorry, I've kind of confused it. I'm wondering what people have shown previously in animal models, because then they can tend to look at more mechanisms and things like that. And up till now we've just been talking about the fetus heart rate, for example. But what about and the mum's blood pressure or something like that? What's happening to the oxygen? Do we have to worry about other things? So for example, the mother's lactate's up. Does that go up in the fetus? All these myokines and all these other things. Do we know much about what's going on there, and if there's other factors to think about? Or
yeah, so I mean, in humans, we certainly don't know a lot. In our HIIT study, lactate was up quite high, as you would expect, and again, we saw no issues with fetal heart rates. So if you want to try and make that link between the two, lactate likely is not adversely impacting fetal heart rate and blood flow. When we talk about animal studies, I mean, those original sheep studies are from quite a long time ago. They were, I believe, looking at 30% and 70% of maximal efforts. And they did see that the higher intensity exercise was, my gosh, I don't remember anymore. I think that 70% there was an issue, which is why we sort of put a limit on it. But I mean, at the end of the day, when we're talking about sheep versus humans, they are slightly different. And so,
yeah, I guess I wasn't very articulate the way I asked it. What I'm getting at is with the human studies, obviously you're not going to be able to get as mechanistic as you can do with some of these animal studies. And I'm just wondering if they had any, because I thought at one stage they were looking at, because I used to be at Monash University, and they were looking at things like oxygen content in the blood of the mother and then in the fetus and things like that. So, and then with the lactate, I was thinking, does the lactate cross into the baby, and can that? I'm not saying it would affect heart rate. I'm just saying, are some of these things, adrenaline, cortisol, other things that are happening with exercise, are they thought to maybe affect the baby in any way, or is that not really a thing? And it's really just, it's the heart rate. If the heart rate's fine, everything's fine. And maybe we don't know. I don't know.
Yeah, I mean, and it's entirely possible. Certainly, you have to do the animal work to be able to figure that out. But when we think about it sort of beyond that acute exercise, at the end of the day, we care about, does the mother develop gestational diabetes, pre-eclampsia, gestational hypertension, other complications like that? Is the baby healthy, born in appropriate size? Are they born early or not? And I think the thing I really missed touching on, which I absolutely should have at the beginning, is with the systematic reviews that we did from randomized controlled trials of exercise-only studies, we found that there was a 40% reduction in the odds of developing gestational diabetes, preeclampsia, gestational hypertension. Higher levels of physical activity was associated with a decreased risk of depression during pregnancy of about 67%. We saw there was a 39% reduction in the odds of having macrosomia, but no increased risk of having a small baby, preterm delivery, or a miscarriage. So while acutely there may be some issues in terms of, what happens with lactate, what happens with increased catecholamines and what have you. And certainly we do need to better understand that when we talk about chronic exercise, the mother and baby's health outcomes are actually quite good. and much
Right.
better than if they don't exercise. And so I think it's really important that we, almost move away from, what are the health risks of engaging in exercise, and focus more on what are the risks of not engaging in physical activity during pregnancy. There's a lot more we need to know, especially when we talk about the extremes of the where you have really complicated pregnancies, and then when we talk about sort of the high intensity and long duration activity. But when we're talking about sort of that moderate into a little bit vigorous activity is very helpful and beneficial for the mom and baby overall, as long as they don't have contraindications where they are not encouraged to do that.
Absolutely. Yeah, I was just thinking while you're talking, I've maybe come across a bit negative. I should give the background. My assumption is always exercise is going to be good. That's what every person I've had on for every different area, it ends up exercise is good. So I tend to sort of start with that. And then I sort of, be the devil's advocate and say, well, what about this? What about that? But so that's fantastic that it's bearing out, and it's kind of like as I'd sort of expect. But yeah, I didn't make it clear enough. So yeah, the baby, the mother, I'm assuming, and it sounds like you've just said that all the benefits that you would get if you're, say, not pregnant even of exercise, the mother's going to be getting, and then the one you touched on, which is very important, is less likelihood of gestational diabetes as well.
Yeah, so and preeclampsia. So preeclampsia is not one we can forget about, because up until the release of the 2019 guidelines, there actually wasn't a broad recommendation in terms of how we can prevent it. So once you develop preeclampsia, we can extend the time to delivery a little bit with different medications, but typically the only way it's actually cured is by delivery. And so the only preventative tool that we really have for preventing preeclampsia in high-risk populations only is aspirin. But with this guideline, where we found that there was a 40% risk in 40%. Or reduced risk of odds of developing preeclampsia, that became a frontline recommendation in terms of prevention. And it's been taken up by organizations around the world. I was very happy to see this review in New England Journal of Medicine by Laura McGee, where they strongly recommended engaging in physical activity during pregnancy. The conversation is finally changing, which is really good. But certainly we need to do a lot more work to better understand all of it from a mechanistic standpoint, right up to what are the differences in the extremes of activities. But in general, it's recommended. You do have to take into account that when you're pregnant, there are definitely days where you feel terrible. You don't feel like getting up. You don't want to do whatever, or you're just sick. And on those days, it's totally fine to just take it easy. You have to listen to, your body and your brain, and take care of your well-being, get back to it when you can. But the other thing that is often missing in the knowledge translation that we do of these guidelines is that activity levels even well below the guidelines do derive significant benefits. So when we talk again about preeclampsia, we did dose response relationships to see if increasing the overall volume of activity was associated with a linear reduction in the odds of developing preeclampsia. And we found that there was, but that to see a 25% reduction in the odds of developing preeclampsia, you needed to go for a walk 9 minutes a day, every day of the week, or 6 days of the week.
But only 9 minutes a day. That's not very long.
Yeah.
Right. So we're not even talking about 10,000 steps and things like that.
No.
And at 9 minutes, was that sort of, vigorous, like power walk, or just a walk?
Moderate intensity.
Really? Wow. That's great.
It's just going out for a walk. So when we talk about pregnancy, especially, we really try to advocate for every minute counts. You don't even have to do it in 10-minute bouts if you can't, just incorporating ways to increase your activity levels, especially if you were inactive before you were pregnant. For a long time, we heard you shouldn't do anything during pregnancy that you hadn't done before. But in this case, with the systematic reviews, again, we looked at those who were inactive before pregnancy versus those who were active before pregnancy. And we actually found that people who started and engaging in physical activity during pregnancy that hadn't done it before, they had better health outcomes and better risk reduction than those who were active before.
Okay, that's great. Okay, so yeah, at the start, we were sort of focusing on the offspring, the fetus and the offspring, which we'll get back to. But yeah, it's important to let's talk some more about the mothers then. So, did you want to just explain a little bit what pre-eclampsia is, what the risk factors are, and things, and then because that's a big one. That was not on my radar. So if you're reducing that by 40%, and do you know how the exercise is reducing that just by dropping the blood pressure? So why don't you talk?
So there's a series of different conditions called hypertensive disorders of pregnancy. I focus on two of them. So one is gestational hypertension, which is a high blood pressure without any other sort of associated effects to go with it. And then the second one is pre-eclampsia. So pre-eclampsia, again, is high blood pressure developing after 20 weeks, the midpoint of pregnancy. But there are associated end organ issues. So the most traditional one is that you get protein in the urine, ketones in the urine. You can also get headaches, blurriness. There can be evidence of issues with the kidney or liver as well. So it's a really key condition that your healthcare provider is going to be watching for sure. In terms of why exercise is beneficial, we don't know. Certainly there's going to be the normal exercise associated reductions in blood pressure. How that's different in pregnancy, we don't know yet. My PhD student a couple of years ago ran a randomized control trial where we were looking at the cardiovascular changes. So we were looking at how the endothelial function was happening or changing with exercise. We also did microneurography to be able to look at muscle sympathetic nerve activity. And in general, we saw that there was a slight reduction in sympathetic nerve activity, the exercising group versus those who were not. But surprisingly, we didn't really see any differences in endothelial function, which is what we would have expected. So we need to do a lot more work in that particular area. You asked about risk factors. Lots of risk factors for it. Certainly, if you have a family history of high blood pressure or preeclampsia, having overweight or obesity, having personal history of hypertension. But one of the ones that makes it so difficult is that being a first-time mom. So being pregnant for the first time is actually a risk factor and one of the key ones.
Okay. And you said 9 minutes could reduce your risk of preeclampsia, and you also said there's a volume, the greater the volume. So when you say the 40% reduction, was that like a greater volumes, I guess, or like what? Can we give a bit of an idea? So if people do 9%, 9 minutes, they might reduce it by whatever percent. Do we? Yeah.
Yeah. So the 60 minutes per week, the 9 minutes a day, is to see a 25% reduction. So that was from our systematic review and meta-analysis. We did that dose response curve, whereas the 40% number would certainly be from a higher volume of activity. The 40% was from our systematic reviews, where basically the exercise group had a 40% lower risk of developing preeclampsia than those who were not in the exercise group. But in general, they had a much higher volume of activity per week that they were doing to be able to get that 40% reduction.
Okay, and it's interesting you're saying that I guess like VO2 max, the lower your VO2 max is initially, the more you can increase it with exercise. You're saying the same sort of thing, the lower the people were exercising, I guess, the more benefit they got from the exercise. Is that right?
The less active they were.
The less active they were, the more sort of benefits they got by being active, which I guess makes sense.
Exactly. Yeah.
Right. And when you look at, has anyone done epidemiological studies to see the outcomes in people that have exercised versus people that haven't? I think you said they have, right?
Oh, there's lots of really great large epi studies that have looked at it.
All right. And if they looked at athletes, sorry, is that looking at the mother or the offspring's health, or both?
Both.
Both. Okay. And have they looked at have they separated that out and looked at people that are doing the vigorous, we talked about the athletes doing the high intensity exercise and the high volumes and things. Have people had a big enough N or looked at athletes, the outcomes for them and the babies?
Mm-hmm. So not when we talk about really large epidemiological studies. So a couple of years ago, my master's students, they actually did, again, a systematic review and meta-analysis, looking at elite athletes who were athletes right before pregnancy and then during pregnancy, and compared it to basically whatever comparator group that the researchers had. Most were recreationally active individuals, and in some cases they were not active individuals as the control group. And there's not tons of studies out there yet. It's building for sure when we talk about athletes, but overall we found that the pregnancy, labor, and delivery outcomes of the elite athletes were very similar to the other individuals. They did not have an increased risk, which I think was the key question that we had.
Yeah, the interesting thing is, if anything, we've been talking about whether there's a detrimental effect on the fetus, but we know, and even I've done some studies, that that exercising the mum can actually have beneficial effects on the offspring. So not just like preventing, not just having no negative effect. So I did a study, for example, where we had fathers. This is rodents, rats. Fathers on a high-fat diet, and then the offspring had increased risk of diabetes, so not as good glucose tolerance, etc. And we showed, so this is the father on the high-fat diet, not the mother. And they conceive, and then the father's out of the picture. And then if the mother exercises during the pregnancy, the offspring have better outcomes. So, and I know Laurie Goodyear's done a whole bunch of stuff from Johnson Diabetes in Harvard, a whole bunch of stuff with, fathers exercising, mothers exercising, high-fat diets, low-fat diets, before the pregnancy, during the pregnancy, or both. And the outcomes are beneficial. So I guess we've been tending to sort of focus, as I said, on is there a negative effect? But do you find, is there evidence in humans, for example, that if the mother exercises during pregnancy, the offspring are actually better and have less diabetes, less blood pressure problems, etc. later in life?
Yeah, so the later in life question becomes quite muddied. There are not that many studies that look at the longer term follow-up of the offspring. That's where we really rely on more animal models. The work that you were doing, the work that Dr. Goodyear have done, that's where we really start to understand some of the mechanisms. When we do our human studies, you can follow up to a certain length of time. You're going to have dropout for sure as we go along. There are some studies, though, where they have looked at the postpartum follow-up of people who had exercised during pregnancy versus those who did not. And there's some encouraging data. Again, it's pretty novel and pretty new. There was a study out of Montreal that was showing higher brain activity in the babies that were from exercising moms. There's other studies out of the States that has looked at the fetal heart, or sorry, not fetal heart, the newborn heart a couple of months after delivery, and found that it's more efficient, lower heart rate variability. And then there was a recent study that came out where they were following up 7 years after delivery, and I believe that they showed that there might be some improvements in overall development as well. That being said, there's just as many studies that show that there's no difference in terms of weight a couple years out in development as well. So it's generally because we have very limited resources to be able to follow up longer term. We do have fairly high dropout. And then you have these external influences. When we have animal studies, we can control what's happening in the postpartum period and later in life pretty well, so that we can understand what that link is. But life gets in the way when we're talking about humans. And so you have those environmental influences that are going to play a role that we are.
Yeah, we've talked about the exercise, but I guess we haven't really thought about when the exercise takes place. So naturally, as you get more and more into the pregnancy and heavier, and it gets more and more uncomfortable, etc. I'm wondering what you've looked at or what others have looked at in terms of do you need to reduce your intensity, your duration? I guess we haven't talked that much about duration other than with pre-eclampsia. And do you just listen to your body? You know, you mentioned earlier, if you feel crap, then don't exercise. Do you sort of say, no, I should keep exercising for my own sake, the baby's sake? Do we know much about that?
Mm-hmm. So, I mean, again, going back to the guidelines, because it was really a watershed moment for the field where we answered a lot of key questions. You know, for a long time, the recommendations in the guidelines were you shouldn't start to or begin new activities until the second trimester. So once the first trimester is over, you're feeling better, alive again, and the risk of having a miscarriage is actually reduced. But it turns out that when we did, again, one of the systematic reviews we looked at was looking at whether or not exercise increases the risk of having a miscarriage. We found no relationship. So for those people who do want to continue to exercise in that first trimester, there's no reason not to, unless you're really feeling like crap or you develop a contraindication. We do know that generally, as pregnancy progresses, overall volume of activity will decrease. Part of that is, you know, the development in the third trimester of discomfort. You are likely to be a bit more fatigued, and complications can arise for sure. But again, there's no hard and fast rules that you should be reducing your activity in the third trimester. If you feel like that's the right thing for you, that's what you should do. But there's also lots of athletes and recreational athletes and elite level that will continue basically until the day before they deliver. And so I think it's really important to support women and facilitate the continuation of activity if that is what they want to do.
Yeah, it's interesting. I was thinking, we did some rodent studies and we had the running wheel, and they definitely, as they were getting closer and closer to having delivering, they definitely did less. They just felt like crap.
The other thing to think about is naturally, you know, as you gain weight, the intensity of what you're doing is going to be higher anyways. So if you're running early in pregnancy and then you gain, you know, 25, 35 pounds, by the time you get to the end of pregnancy, the intensity is potentially still the same, but you're doing a brisk walk instead.
That's a good point. I didn't think of that, to be honest. Yeah, because they were doing, on the running wheel, they were just doing less revolutions per day. But yeah, they're carrying more weight. We didn't think through that, to be honest. Okay, just going to the questions here. Okay, so you're basically saying, I think, and you sort of said it earlier, there's no real hard and fast rule. As you're getting later in the pregnancy, if you're feeling uncomfortable, whatever, just listen to your body, I guess.
Yes.
But as far as you know, there's negative. Sorry, as far as you know, there's no negative of pushing through it.
And so the one thing that I should highlight is, again, these ideas of contraindications. So we just touched on them really briefly, but I think we should probably talk about it in a bit more detail, since this is, you know, trying to get rid of misinformation. So contraindications are medical conditions where physical activity in the moderate to vigorous zone, what we would typically call exercise, may not be recommended. There's two different types. The first is an absolute contraindication, and the second is a relative one. So with absolute contraindications, these are things like severe pre-eclampsia, intrauterine growth restriction, so the baby is not growing to its potential. Engaging in moderate to vigorous intensity exercise is not advised because there is some either empirical evidence or theoretical concern where there might be harm to either the mother or the baby. So those are absolute contraindications. The key thing is that we know that bed rest is not beneficial for anybody, also not in pregnancy. And so we still encourage activities of daily living, still mobilizing, you know, get dressed, go into, you know, if you want to make breakfast, that sort of thing. But staying in bed is not beneficial, especially for mental health. And it's not been demonstrated to be beneficial for fetal and pregnancy outcomes either. The second one is the relative contraindications. Relative contraindications requires a discussion with your healthcare provider. about whether or not basically the pros and cons of exercise, or whether or not modifications need to be made to either the intensity, duration, type of activity, what have you. But in the vast majority of cases, a continuation of exercise is recommended. Often there will be modifications that have to be made either then or a little bit later. But continuing activity, if you're feeling okay, is generally recommended. And so screening for those is really important.
So I guess not pushing. So if you are healthy, there's no contraindications, etc. You're not necessarily saying you're wanting people to continue to exercise if they feel comfortable, but if they're not feeling like it, they should. The other thing is, should people be seeing their doctor? Because I know often we say, "Oh, see your doctor before," but their doctor may not know these things. The doctor might say, "Oh, no, don't exercise." So it's a bit of a tricky one.
Mm-hmm. So it's a great question. You just led me right into the Get Active questionnaire for pregnancy. So going along with the 2019 guideline, the previous iterations of the guidelines was exactly that you should go speak to your healthcare provider. But the feedback that we were getting is, people were stopping exercise when they became pregnant. They would often not see their healthcare provider until they were sort of, 14 weeks, maybe a little bit later. And they had done no exercise for, 3 months. And so that's not necessarily beneficial for somebody who is highly active before to do that. And so in consultation with our healthcare provider partners, we developed what's called the Get Active questionnaire for pregnancy. So it's a screening tool which follows ACSM recommendations, where basically pregnant individuals are going to fill this document out. They answer a series of questions to identify whether or not they should be speaking to their healthcare provider about physical activity in pregnancy. And the goal is to basically remove this major barrier to exercise during pregnancy so that they can actually derive the health benefits, again, if they're feeling up to it. And this is sort of moving along that same line of thought, that we need to stop talking about what are the risks of physical activity. Again, we still need to know more about it, but within the scope of the guidelines, which is that 150 minutes of moderate intensity physical activity spread over 3 or more days of the week, we need to move away from what is the risk of that, because we know that the guidelines are healthy and safe for the vast majority of people, to what are the harms of not being active during pregnancy.
I have to admit, I didn't actually realize that people were, I knew obviously that there's a greater risk of miscarriage, etc., in the first trimester, but I didn't realize people were sort of therefore not exercising, because I just assumed that was nothing to do with exercise, that risk. But yeah, so people were actually purposely not exercising during that first trimester because they know it's a risk they know there's an increased risk of miscarriage, but they think somehow the exercise will make it worse.
And so there was a very large epi study that was done, it was quite a while now, early 2000s maybe, where they surveyed a lot of people. The numbers are completely escaping me right now. But they asked them either before or after they had miscarried, about their different lifestyle factors, smoking, alcohol, but also they were asking about their physical activity levels. And one of the things that came out of it was that high intensity, high volumes of activity in the first trimester was associated with an increased risk of having a miscarriage. That spread worldwide. And it's certainly, if you've had, for those of you who have been pregnant, miscarriage is a really terrifying thing that happens and something that you want to avoid at all costs. But we also know that 1 in 4 women will experience a miscarriage in their lifetime, and often it's due to completely unrelated events that you simply can't control. But if it is something that you can have within your control, then you're going to want to do something about it, very likely. But the problem is that, and the authors actually went back and they redid the study where they limited it to asking about physical activity before the woman had miscarried. and they found that there was no more relationship
Oh.
at that point in time. But that message hasn't come through the same. And that's why we made a very strong statement with the title of the guideline, which is that it's the Canadian Guideline for Physical Activity throughout pregnancy, right from conception right to delivery. And again, it's not designed to create a lot of pressure that you must exercise during pregnancy. We know it's beneficial. We know it's very helpful, but moms experience a lot of guilt. At least I certainly did as a mom.
Okay.
And so focusing on both your physical, but also your psychological and mental health is a really important balance. And so we're trying to remove the barriers to exercise during pregnancy. We know it's beneficial, but if it's not right for you at that point in time, then it's not something that you can really incorporate, if that makes sense.
Yep, it does make sense. Just clarify again. So you said the study found there was an increased risk of miscarriage in the first trimester if you exercise, and then they didn't. I got slightly confused there. What was the...
So it's so some people had been interviewed about their activity levels before they miscarried. Some people were interviewed after they miscarried. And so there was this concern that there might be recall bias, because there's been a long time where there's this thought that if you exercise too much, that you're going to have a small baby, you're going to miscarry, you're going to have a preterm delivery.
Okay, and they found in the end, that when they reanalyzed it, that's the bit I missed. Sorry, when they reanalyzed it, they found. Sorry.
You may want me to start right at the beginning. So basically, when they reanalyzed the data and they only included people who were interviewed about their activity levels before they miscarried, there was not a relationship anymore. Okay,
so the bottom line is it looks like there's no relationship. It's not improved, it's not worse. It's basically no relationship if you exercise or not in the first trimester on miscarriages. Okay, great. Well said. Now, I just want to get back to I just want to ask a very applied question that Jacob sent through. I think we know the answer from this one already, but I'll just reinforce it. How to adapt/modify training for women who are already in an exercise routine prior to pregnancy. So do they need to adapt, modify? Second one, how to program for those who may not have been exercising but wish to begin during pregnancy. So again, we've kind of covered this, but it'd be nice just to drive it home, I guess.
Yeah, so my view, and lots of people have different views for sure. I really advocate for an individualized symptom-based approach. So some people are going to feel very pregnant very early on in pregnancy. You get, obviously, one of the key features of pregnancy is that you have a growing belly. And so you will have to adapt around the belly at some point during pregnancy. If you're an athlete who's lifting heavy and you're a barbell athlete, at some point, you're going to have to move the bar around the belly. It's going to change your technique. I used to be doing Olympic lifting and my technique was terrible. And, it's very easy to untrain it. And so we suggest making adaptations, like just going to dumbbells doesn't help our really, really strong athletes. You can't find a dumbbell high enough or big enough. There can be other things, just cycling might become very uncomfortable because by the end of pregnancy, just the hormonal changes that are happening, that your pelvis is actually starting to loosen to allow for delivery, and it can be uncomfortable on the bike for some people, not for others. And so
is that Relaxin? Is that Relaxin that does that?
Oh, there's debate on that. So Sinead Dufour is probably the world leader in that particular area. So I'm doing some work with her through FIFA, and I've been schooled on Relaxin. She knows it all, and it's very unlikely that Relaxin is the answer to everything. She has me.
It's interesting because my wife, with our crap, I should remember this. Our firstborn, I think, she was running. She was a runner before pregnancy. She ran the whole way through, and then she ended up like in a wheelchair at the end because her pelvis was just so. For the last few weeks, she just was so unstable and things, and it was all relaxing. But you're saying it's controversial.
Yeah, it's very controversial, and I'm learning a lot more about it. Relaxin is going to play some role in terms of, allowing the allowing the skeleton just relax a little bit, the pelvis to allow for the delivery of the baby, but it doesn't do everything we think it does.
Okay, now I just want to get back to some things you said earlier. So, because I did some studies as well on rats that were born small, and then we exercised the offspring and things like that. Now, you mentioned earlier that there's no, because naturally you don't want to actually want a baby born small. You don't really want a baby born heavy either. Did you say there's no real change in the baby's birth weight with exercise? Is that what you said earlier?
So it's really interesting. The way I conceptualize it is that we're seeing a bit of a normalization in the birth weight. So with the systematic reviews, we didn't see an increased risk of having a small baby, but we saw a decreased risk of having a large baby or a macrosomic baby. And the reduction was about 39%. So it's significant.
Yeah.
And so how that actually is working, the physiology is, I think, really quite fascinating, and I don't think we have a good answer on it yet. When you're exercising, you're going to have an increase in blood flow delivery to the placenta, which is then going to go to the baby. Perhaps you're getting, better oxygen, nutrients, what have you, going to the baby, that if you were less active might not happen on sort of like that small end. On the larger end, the mechanisms might be a little bit different in terms of thinking more about, improvements in blood glucose, blood sugar in the mom. Is if there's excess, it's going to go to the baby and it's going to be laid down typically as fat in the baby. And so if you're exercising, the baby will not see those blood sugars and increase their body weight as a result, if that makes sense. But
yep, it does.
The short answer is we don't know. That's where we really need the animal work to come in.
Yeah. Now, thinking about it, we touched on gestational diabetes earlier. Maybe if you can just explain what that is a little bit. And we've had a lot of people on the podcast previously, and it's an area of my background about how exercise improves insulin sensitivity. And it's interesting because exercise is naturally going to make the mother more insulin sensitive. But a normal response, I was thinking, was with pregnancy is the mother becomes a little bit insulin resistant, so that my basic understanding was so that the baby sort of gets the glucose first rather than the mother taking it. Maybe can you just explain all of that a little bit? It was kind of convoluted, but hopefully you followed what I was getting at.
I think so. So gestational diabetes is the presence of high blood glucose, blood sugars that arises for the first time or is first diagnosed during pregnancy. There are very specific thresholds that you need to cross. You're absolutely right. During pregnancy, pretty much everybody becomes insulin resistant to a certain extent. If you become too insulin resistant, then you can have too much blood glucose in the system. The excess blood glucose, you're right, will go to the baby. The interesting thing about the baby is that glucose will cross placenta, insulin does not. And so the baby is going to see that glucose, and then the immature pancreas is going to produce its own insulin and lay down that excess glucose that the baby is seeing as body fat. When we have exercise, basically what's happening is the way I conceptualize it is that you're basically normalizing those blood glucose values through non-insulin mediated sequestration of the glucose into the muscle, so the baby doesn't see those excessively high blood glucose values.
Okay. And does it matter then? Okay, so just clarify that a bit. So for gestational diabetes, it's a problem because the mother's glucose is becoming too high. Yeah, she's getting diabetes. And then that's flushing through the baby. So it might end up with a higher birth weight in the baby because it's getting all this glucose. Yeah. And then, as you said, the mother tends to become insulin resistant, and that's a normal thing, so the baby gets the glucose.
Exactly.
Now, because the mother's exercising, she's going to be improving her insulin sensitivity. And does that actually, is that a problem in a way? You know what I mean? Because it's normal to get insulin resistant. But if you don't get insulin resistant because you're exercising, does that really matter? It probably doesn't really matter. It's overcome by all the benefits.
So I think where we would become concerned is if we saw hypoglycemia, low blood glucose after the exercise. Unless somebody is on insulin, we actually don't see it very often. If they're on insulin, then it's definitely a risk. And so there's different things that we need to do in advance. In my lab, if we have somebody who has gestational diabetes on insulin before they exercise, we'll measure their blood glucose, make sure it's above a certain threshold. We typically will instruct them to make sure you eat at a certain time before the exercise, and we always test it after to avoid hypoglycemia. But we don't typically see that in somebody who does not have gestational diabetes who is exercising, or somebody who has gestational diabetes and is not on insulin.
Yep. Now, you said you get a reduction in the gestational diabetes levels. So we talked earlier about pre-eclampsia, getting up to 40%. What sort of reductions are you getting with mothers that exercise during pregnancy?
Exactly the same. It's 40%.
Oh, really?
Wow. Yeah, I think so. I usually just say it's a 40% reduction in gestational diabetes, preeclampsia, and gestational hypertension.
Okay.
My memory really works. I think it's 39% for gestational diabetes, 41% for preeclampsia, but my brain doesn't work that well.
That's very close. I think we'll round that off.
Enough.
So that's great then. So that's really important because, again, I'm not an expert in this area, but my understanding is if you get gestational diabetes during a pregnancy, you're at greater risk for developing type 2 diabetes later in life. So you actually, by reducing that, you're not just reducing the gestational, I'm assuming you're reducing the risk of type 2 later in life as well.
Yeah, no, absolutely. I mean, those are three really important pregnancy outcomes that we look at because they are so intricately linked to risk of future diabetes and cardiovascular disease. So having preeclampsia, and the more severe the preeclampsia, the more likely you are to develop cardiovascular disease at an earlier age. And so if we can prevent it during pregnancy, the thought is that we might be able to either prevent the development of type 2 diabetes and cardiovascular disease, or at least delay their onset until later in life. That's the theory. It hasn't been tested. And so we do need to do those studies. Certainly animal work is going to play a really important role just because of the timeline. Epidemiological evidence is suggesting that might be the case. But that's a long haul question for sure.
Okay. And now another one, I think you may have talked about this one already, a systematic review of meta-analysis 2018 that you were first author on, prenatal exercise for the prevention of gestational diabetes and hypertensive disorders. So I guess I'm wondering about, I guess it's ideal if you've been exercising before pregnant and then during pregnancy, but versus before only and during. Do we know that? I know Laurie Goodyear, again, I touched on earlier, did before, during, and both was better. Do you know that sort of breakdown in humans for these diabetes and hypertension?
So there was a little while ago now, which I can't remember. I'm sorry, I'm blanking on the author group, which is very terrible. I apologize in advance. But they basically showed with both preeclampsia and gestational diabetes that higher levels of activity before pregnancy and then in early pregnancy actually did have a better benefit. The one sort of caveat with that one is that they were all primarily based on observational data, so the epidemiological data, which is not going to be quite the same quality of evidence that you would get with an interventional study. The problem is, again, that's why, Dr. Goodyear's work is so critical. When we talk about working with humans, not everybody's going to get pregnant the first month, first 6 months, first year. And so when we're doing exercise interventions before conception, it could actually be a very long time before you get a pregnancy outcome and see if it's able to prevent gestational diabetes or preeclampsia more than if they started during pregnancy.
That makes sense. Okay. Again, it's harder to do these studies in humans. And that's why, sometimes people say, oh, why do you do animal research for? Well, it's a good example. If you're doing, born small and then they develop diabetes, in their 50s, it's a bit hard to do it. So when you do an animal, a rodent study like a rat, where they only live 2 years, you can actually get a lot more information. Now, Mark Preburn-Lindback has another good question here. You're saying and it fits with your talking about insulin, I want to touch on during gestational diabetes. So if someone's got gestational diabetes and they've got perfect glucose control, which they've actually managed to achieve by the insulin therapy, yeah, what other benefits will the pregnancy and fetus, the woman and the fetus get from exercise, and what mediates this? I wonder if that's known.
Great question, hard question to draw in human evidence, but again, we know that exercise is quite beneficial for the general population, certainly for pregnancy. We don't have a lot of data to support this necessarily, but we know that people with gestational diabetes, that they are at increased risk for developing preeclampsia. And so, even if you have perfect gestational or GDM control, you can still focus on reducing the risk of developing preeclampsia, because there's going to be cardiovascular benefits to exercise. The other piece we haven't really talked about very much, but is essential during pregnancy and postpartum, is the mental health side of things. We know that pregnancy is a period of greater vulnerability. We really have to think about a mom's mental health, which is why I'm a big advocate for, trying to find out ways that we can help support athletes to continue their training during pregnancy. It might look different, but we can't be telling people to completely stop. That's their identity. Same thing. We don't want to be telling everybody that you must exercise during pregnancy if it's actually going to adversely impact your mental health. Physical activity during pregnancy, and there were very few studies when we published the guidelines, but we found a 67% reduction in the odds of developing overt depression during pregnancy. And so those are really important outcomes to be thinking about as well.
Yeah, that's huge. I did pick up on that earlier, and I did want to get back to it because I think that's really obviously very important. Now, what I was thinking about is I heard somewhere along the line as well that this so-called postnatal depression is a bit of a misnomer as well, because apparently a third of depression develops in the first trimester. A third develops early in pregnancy, a third develops late in pregnancy, and a third develops post pregnancy, after the baby's born. So it's not just postnatal. But anyway, I'm wondering if they've looked at that, if the depression reduction is, is it more the exercise reducing it during the pregnancy, after the pregnancy? Do we know that sort of both? Hopefully both.
Yeah. So the data that I just quoted with that systematic review, that was specific to pregnancy and depression. There's a pretty big event that happens in the middle between pregnancy and postpartum, labor and delivery. Some people have very smooth, easy deliveries. Some people have very traumatic issues that will persist, that increase the risk of having depression postpartum. So we were a bit surprised that while physical activity and exercise in pregnancy reduce the risk of depression, it had no impact in the postpartum period. More data has been published since then, so there might be some benefit, but I think childbirth is so significant, we can't sort of discount that. That being said, I'm also leading the upcoming 2024 Canadian guidelines for the postpartum period. And so we have done systematic review and meta-analysis where we found that engaging in physical activity postpartum does reduce the risk of depression and depressive symptoms as well. The other piece, we talk a lot about depression, but I would say an even larger proportion of the population experiences some form of anxiety during pregnancy and postpartum. And that is like, if there is a call to action in that particular area, we don't have enough evidence yet. It's like the forgotten child of mental health in pregnancy and postpartum, but so many people are suffering in silence. And so we need to understand that better.
Yeah, and they're obviously very sort of closely linked, because I know nowadays, they used to be, if people were highly anxious, they used to give them Valium, but now they're saying there's quite addictive and things. So quite often, for SSRIs, for example, for depression, have an anti-anxiety effect as well. So they're naturally very, very linked. Just thinking here, I had something about, you had a first author paper, Filling the Evidence Void, Exploration of Coach and Healthcare Provider Experiences Working with Pregnant Postpartum Elite Athletes, a Qualitative Study. What was that about? And what were you thinking about there?
Yeah, so I mean, that's a quick turn into elite athletes. Bringing in my former background as a synchro swimmer. Um, back in when I was doing grad school, we didn't hear about high-level athletes continuing during pregnancy and postpartum. And really, even when I started my academic position in 2013 here, we didn't talk about it. We didn't hear about it. And everything changed in 2019 when Alison Felix published this opinion piece in the New York Times talking about her struggle to keep her sponsorship, to be able to have maternity benefits. She was the most decorated, high profile athlete in the world, and she struggled. And so, after reading this article, I went to visit a friend of mine in the faculty who does qualitative work. And so we started talking about it, and I was like, I don't know how to address this as a exercise physiologist, as a quantitative researcher. Can we do something on a qualitative standpoint? And so since that time, we have started to do and published about 4 or 5 now papers looking at the experiences of elite pregnant and postpartum athletes, what they were experiencing, thinking about before they made the decision to become a parent, what their experiences were during pregnancy, and then their return to sport experiences postpartum. The study that you're talking about was a little bit different. We were looking at the experiences of coaches and healthcare providers in working with and training these athletes. A lot of this work is going towards working certainly a lot more on the physiological standpoint. That's obviously my home, what I understand, and we're very actively working towards that. But the other piece is more of a policy standpoint. We need to get the supports in place for athletes to be able to have children, start a family, and be able to return afterwards. And so what are some of the key pieces that came from that is, coaches have about as much information about training elite athletes as I do as a researcher. There's not a lot of information. There's not a lot of really solid evidence-based recommendations. And so they were really calling for the fact that they need these recommendations to be able to support them. They wanted to have clear policies in terms of the parental leave policies for their athletes. They wanted to have return to running guidelines, return to sport guidelines that were, individualized for their athletes. And currently they're coming a little slower than we'd like, but they are in process. And actually they might even be out later this year. But the data is coming. But trying to understand a little bit more of what their perspective is, what their needs are, was really important.
Oh, so lots to consider then, I guess. Now, I can't help wondering, and I was thinking earlier as well, is what percentage of athletes do you know sort of do come back? So we kind of hear more and more these sort of examples of people that have, come back and won the Olympic marathon after having 2 children, and some people, I can't remember the name of I think she's from Trinidad, 400-meter hurdler or something. What's her name now? I should know her name. Anyway, she was like, 2 months after having a baby, she got second in the World Championship 400 or something. Do you know how often is it that, do you know sort of how often do athletes keep going? Do they do better? Do they do worse? Do they do the same afterwards? I mean, it's probably so many factors to consider. And we hear the sort of celebrated examples where they come back and win a gold medal when previously they'd won 2 bronzes, but it doesn't mean you're going to be better. And you've got so much more, so much less time. Maybe they have to train more efficiently. Who knows what's going on. Do you know much about that at all?
Yeah. So, I mean, this is a big part of the work that I've been doing most recently, is looking specifically at elite athletes. Going back again, systematic review back in 2021, where we looked at return to sport postpartum. And basically, we don't know how many athletes are retiring to be able to start a family. We don't know how many athletes would have continued on if they had the appropriate supports in place, and a supportive sporting organization, coach, teammates, etc. But what we do know is that of those athletes that do come back, that many of them are able to go back to their same level of performance that they had pre-pregnancy. Some of them are exceeding preconception performance levels. Since the time we published that particular paper, there was a study that was looking at 37 marathoners who were training during and then returned to sport afterwards. And they actually found that 70% had their personal best performance after childbirth. Trent Stellingworth and Francine DeRoche published another cross-sectional survey-based study of 42, like the elitist of the elite runners. And they found that more than half had improved performances during or following pregnancy. Certainly in both cases, there seems to be an increased risk of having an injury. We suspect that this is due to a very rapid return to sport, and that's why the return to sport guidelines are really important, that they're individualized, that they're symptom-based, and they're graded, not just, well, I had a baby today, 6 weeks later, well, you're cleared and you're good to go and you can run a marathon if you want to, which is what we had up until very recently. So the data is really starting to support that, at least in certain sports, that it's you can actually have what we like to call a pregnancy advantage, where with all the physiological changes that are happening during pregnancy, you have a 50% increase in blood volume. You're going to have, a 30 to 40% increase in cardiac output. Over the course of pregnancy, those adaptations are going to reverse, but they don't disappear postpartum. And so you have a more efficient cardiovascular system, which may confer a benefit, especially in the endurance sports.
Oh, I had no idea about that. I just assumed things went back. So you're saying, what, for years later, they have still a higher, maximum cardiac output or higher stroke volume, or what do they have?
So we don't know how long these effects persist. There was a study that was done many, many years ago that showed that there were changes or differences that persisted at 1 year postpartum. We did interviews with coaches and, those in the elite athlete endurance sports. Some suggested that they were seeing the first year, maybe they're not returning to performance, but it's really that second year where they are. Whether or not it's directly related to only the cardiovascular system, I doubt it. But there seems to be some sort of advantage. And I also worked with Sport Canada to develop some sport policy for Canadian athletes. And so we did speak to a large number of national sporting organizations. I didn't make up the pregnancy advantage title. That actually came from one of the coaches, but they're seeing it on the ground. We're seeing these performance benefits in the research.
Well, I wonder if part of it's the pain threshold after going through pregnancy.
It can be that. As an academic, a lot of my predecessors waited up until, after having tenure and whatever else to be able to have children. We don't see that as much anymore. I had my kids earlier. And I actually, from a personal perspective, I am much more focused and efficient in my day than I was before I had kids. And we've heard from athletes the same sort of thing, that they're focused. They don't do the extraneous stuff. They take care of what they have to do for the training, and then they go back and they take care of the other aspects of their lives.
Yeah, so more efficient. But yeah, with the pain threshold, I was thinking, because we've had, I've done a whole bunch of muscle biopsy studies. And at one stage we've, I've had 33 myself. At one stage, usually people say, why would you have so many? Usually it's training new doctors, to be honest, because I don't want them to do it on the participants or the students. But so it's been fun. But what was I getting at? Yeah, so when we do biopsy studies, we've actually found that when you do people with type 2 diabetes, males and females, you find that the older people tend to complain less about, biopsies, and especially the females. And I've had several comments where it's like, compared to childbirth, this is nothing, So I was getting at with the pain threshold. I guess if you've had especially a very difficult pregnancy and childbirth, you might be like, all right, this doesn't hurt as much as I thought. If you're a marathon runner, it's like, So slightly flippant, but maybe, might have something to it. Who knows?
Yeah. I mean, again, there's so much we just don't know. We almost don't know what we don't know yet.
Right. Now, the other thing I thought about was maybe diet. So naturally, when you're pregnant, you're eating more, and you might be eating differently with various cravings and things. Do we know much about, are there dietary considerations for pregnant, especially athletes, I guess? Have people thought about that really? Do you know? Or
you know what? Many people have thought about it. They're all much smarter than me. I ran away from dietetics and have a very superficial understanding for sure. So, I can only give a really superficial answer. But basically, we know that, when you are pregnant, that there's going to be an increase in energy expenditure. It's not actually as much as you might think. First trimester, the caloric expenditure is actually trivial. And then by the time you get to the end of pregnancy, it's equivalent of 2 glasses of milk. So the energy expenditure of pregnancy that you need to be intaking is it's not twice as much.
It's less than you think.
It's healthy.
Yeah, you're not eating for 2 type of thing. Yeah.
Right, exactly. But then when we talk about the combination with sport, it's really important to think about whatever your energy expenditure in your training and competition is actually going to be. And so definitely working with a dietitian is really, really important. Maintaining hydration is essential when you're pregnant. Dehydration can cause uterine contractions, which is something we try to avoid earlier in pregnancy. Making sure that you have sufficient iron. A lot of pregnant women will end up having low iron during her pregnancy. It's physiological anemia, partially due to the fact that the blood volume is increasing, partially because, there's increased iron needs. And so even postpartum, we actually see that a larger number of individuals are experiencing anemia postpartum as well. So if you're an athlete, taking care of your diet, nutrition is really, really essential. It is for all of us. But when your performance and your livelihood is dependent on it, it's even more essential.
Yep. That makes sense. Now, Mark again asked a question. It's quite a specific one. We may not actually know, may not know the answer to this one. Can supplementation of, for example, EPA fatty acids augment the benefits of exercise for the fetus? And to what extent can exercise compensate for a poor diet? But the old sort of can you outrun a poor diet in terms of the fetus and the mother? I don't know if you've thought or if anyone's looked at that.
Yeah, I mean, it's a great question. It's certainly one that I think we should try to understand a little bit better. But at this point in time, I have no idea.
Yep. Fair enough too. What about the effect of age? So has anyone looked at, I don't know, exercising and when people start worrying about after 40 and things like that? Has that been looked at at all?
Yeah. So with the guidelines and the systematic reviews that we did, one of the key questions that or subgroup analyses that we tried to do was looking at, was there a difference if you exercise before you were 35 or after you were 35? And not a single study at that particular point in time had published on the effects of age, the exercise effects on, the age effects on exercise. So when we talk about age in pregnancy, because we're actually talking about really young, otherwise healthy individuals, but they're on what's considered on the older end of things in terms of becoming pregnant. Once you cross this 35 magical threshold, so I was 36 with my second pregnancy. I was actually very annoyed at the physician who called me geriatric at that point in time.
What? No
the terminology is awful, and we have to be
ridiculous.
But the epidemiological, yeah,
right.
I could go on a bit.
You're not even geriatric now. I'm not even geriatric, but that's starting to push it. Maybe I am, but anyway, yep, okay.
But when we talk about, chronological age, when we talk about 35 or over 40, there are age-associated increased risks for developing things like pre-eclampsia and gestational diabetes. We shouldn't be calling anybody who's pregnant geriatric. I think it's terrible. But
I think by definition, if you're pregnant, you're not geriatric, surely, to goodness.
there you go.
Yeah.
But we'll save that conversation for another day. Lived experience here. But where was I going with this? Right. So if you have an increased risk for developing gestational diabetes and preeclampsia, there is the possibility that engaging in exercise, whether or not it's for the first time or the first time for a while, might confer additional benefit, but the data isn't there to support it.
Okay. All right. Now, what I like to do, I've started asking this question. Are there controversies in the field? So what I'm getting at there is everything you've said pretty much recognized by other researchers and things, or is there like someone where you think, oh, well, if this person was being interviewed, they'd say it very differently? Is there anything we've talked about? Because I can't obviously know all the areas that I interview people about. Is there anything we've talked about which is kind of controversial and you say, well, actually some people think this and that?
Mm-hmm. Oh, absolutely. So, I mean, the HIIT, the high intensity work that I did,
yep.
and the heavy lifting work, you know, that is highly novel. That is brand new, coming out. You know, in terms of controversy, I think the biggest question is, those are single studies, relatively small because it's a physiological study. You know, we definitely need, and I fully acknowledge and strongly recommend we do more studies looking at it. We need to look at the chronic effects as well. And we need those prospective studies to be able to better understand it and get that high quality evidence so that we can actually get it into the guidelines. Or if I am completely off base and these data are wrong, that also needs to be demonstrated. I think the biggest controversy, at least in, you know, my standpoint, is that there are such massive gaps in our knowledge about exercise during pregnancy. It's even worse in the postpartum period. That's where my PhD was. It's scary, but when we talk about pregnancy, there's a lot we don't know. And there have been limitations placed over a long period of time in terms of what we can and should be doing. But we can't be making guesses about what the effects actually are. We actually need to do the high quality data collection to be able to test the hypothesis and understand whether or not these activities are safe or not. Whatever limitation you place, whether it's you shouldn't do high intensity, you shouldn't do long duration, you shouldn't lift heavy, you shouldn't exercise with a certain contraindication, people will still do it if the evidence isn't strong enough to support not doing it.
It's true. Great. All right. And we've got naturally there's the same problem that we've talked about, I've talked about with several people. So Abby Smith-Ryan, Kirsty Elliott-Sale, and someone else, sorry, that, you know, there's not enough studies done in females already. And now this is a subset. So I'm sure it's greatly, you know, understudied.
Mm-hmm. Oh, no, yeah. Absolutely. And I mean, a lot of it, you know, when I was in grad school, I was often asked, why are you doing women's health? We have all this data on exercise physiology 20 years ago. Why would you think it's any different? And when we talk about a small population that only affects about 80% of 50% of the, you know, I'm really messing that one up.
It was 100%. It's actually 100% because all of us were born from a, yeah, exactly.
Ooh, there you go.
Yeah, all of us were born. So.
It's like 80% of all women across the world are going to become pregnant at some point in their life. So pregnancy is a pretty significant event, but we just don't know enough about it. There's got to be a lot more work done. But there are two sort of things that I see. One, we absolutely need the funding. And then the second thing, there have been studies that have been put out that if you have a female PI, they're more likely to do work with female-based research and train female trainees that are then going to go on and do more female-based research. Certainly not the only answer. We need to have broad spread experiences and to be able to do those studies. But we need the funding and we need more people just working in the areas in general.
Absolutely. Now, one thing I've started asking as well is, you know, a large reason why I started Inside Exercise is I want people to get their information from the research experts in exercise rather than from influencers. Yes. So I know we're both on Twitter, and there's a lot of stuff that goes around in there, some misinformation and things. What I've started asking people is, is there something in your area, which we've probably touched on already a little bit, but is there something in this area we're discussing that is like a pet gripe of yours that people get wrong on social media or just generally?
Yeah, I mean, the big thing, for me is this persisting idea that you can't go above 140 beats per minute. It's been around for 40 years. It's constantly coming back. When we look at people who are going above that and they're still within the guidelines, they get slammed on social media. It can be pretty awful. And I think that it's important that we need to do the research to be able to support people's choices in their pregnancy.
So who's getting slammed? People that are doing high intensity stuff?
No, people who are going above sort of a moderate intensity. If you're doing more than walking, so
yeah.
People, you hear on Twitter, there was like something I was reading on Twitter very recently where somebody was pregnant and she was out for a run and people were stopping their cars to tell her to stop. You're going to kill your baby. Steph Rosenthien, I'm saying her name improperly. She is very active on Instagram. She was a like the 3-time mom, but also an Olympic marathoner for the United States. And she had huge backlash. There was a very short video talking about all of the comments that she got, and she was doing something that was actually very healthy and beneficial, not only for her physical health, but also for her mental health as well.
Wow. Okay. So these things are, it kind of remind you of back in the, was it 1970s or something? They said women shouldn't be doing marathons, they shouldn't perspire and all this stuff. Sounds like, what did you say, 1200 BC? They were closer.
Oh, 1400 BC.
What were they saying? What were they saying then again?
Yeah, so back in 1400 BC, there's like a snippet that's in the book of Exodus, which is basically that the slave women had better pregnancy and delivery outcomes than the sort of higher born.
Isn't that great?
Isn't it wild?
That's
and
wild,
we're finally getting back to, those times. Not that we want to go back to those times. There are other issues that cause pregnancy complications, but recognizing the powerful preventative effects of physical activity during pregnancy for mental, physical health, and well-being.
Well, this is almost a takeaway message time, but I might just have an official, because I'd like to finish up with some takeaway messages that you want people to get. One is to go back to 1200 BC and look at what they were saying. But so what are some takeaway messages you want to get out there and make sure people get from this chat?
I think the biggest one is that we really have to change our view. And I've said this a couple of times, we have to change our view away from what are the potential harms of being physically active within the current recommendations to what are the harms of not being active. There is extensive, strong evidence out there that engaging in physical activity before, during, after pregnancy is associated with many health benefits. There are lots of caveats that we need to highlight, contraindications being one of them, focusing on being within the guidelines. If you go beyond them, that's when you should be speaking to your healthcare provider. But we are going to be coming out with much better evidence in the next year or two. There's some really exciting work that's coming out.
Great. All right. Now, just one thing I've been meaning to say, and you just said physical activity, exercise. We're tending to use them interchangeably a little bit.
Yes.
Can we just sort of just talk about that a little bit? So, physical activity is more, I guess, going for a walk. And do you want to just explain that again a little bit?
So physical activity is crossing a broad spectrum of activities across the intensity spectrum. So it includes light activities, which would be, walking around your house, doing dishes, getting dressed, that sort of thing, into the moderate intensity to vigorous intensity zones, which is where we think of exercise. So exercise is a component of physical activity.
So if we just to summarize, if we can just say, are there proven benefits of low, moderate, and high, or would you say the high, which is a little bit right now?
Yeah. So I think the really high intensity exercise, it's early.
Mm-hmm. But if people are doing it and they want to do it, and athletes are doing it anyway, you wouldn't be sort of discouraging them if they don't have risk factors. Is that right?
So I would strongly recommend that they speak to their healthcare provider and get very strong guidance from their healthcare provider. It's important to be thinking of a number of different factors. You need to make sure that fetal growth is appropriate. You have to make sure recovery is appropriate. Counting kicks, so making sure that there's, as best as you can is really, really good. But it's always going to be a balance between your mental and physical health. I have a couple of case studies that I'm working on right now. One's with an ultramarathoner, one's with a pro cyclist who trained throughout their pregnancy. We need to get those data to be able to see what happens on sort of those more extreme levels of activity that we don't have really in the literature yet. There are a couple of cases, bits and pieces that are available, but we really need better evidence. But I do hope that we are going to have some better recommendations for those extremes of activity soon.
And then hopefully their health provider actually knows they're not just going to say, oh, don't do it. So maybe they should come along with this podcast. I don't think the doctor will watch the whole podcast, but maybe the takeaway messages. Okay.
Mm-hmm. Yeah,
Right.
No, absolutely. And education to the healthcare providers is one of the key take-homes of that qualitative study I talked about. And so we are moving towards developing much shorter key take-home messages for healthcare providers in particular.
Great. Okay. Well, I found this really interesting. Thanks for coming on, and good luck with everything. And hopefully I'll see you around at some stage.
That sounds great. Thanks for having me.
Okay. See you. Bye-bye. I hope you enjoyed this podcast. And please like, subscribe, pass it on to your friends and colleagues. Check out the other podcasts. Thanks again.